Hi everyone, welcome. This is Roxanne with you today, and I just want to say thank you guys for subscribing, and please go ahead and hit subscribe if you're viewing. All right, so today I want to share a little bit on the topic of anxiety. And I don't know if you've ever been in a situation where your heart is racing and you feel that there's some perceived threat of being harmed or some danger. Well, the sympathetic nervous system has a way of kicking in, and persons are experiencing what we call the fight or flight mode. So the body's getting ready, the brain is preparing the body for fight or fleeing from a situation. And sometimes it's a perceived threat, but sometimes there's nothing really for us to feel worried about. But this is how the body is reacting to a fear of danger. So anxiety, it can, of course, it is natural, responding in this particular way. It's a mental reaction. It's also a physical reaction to this perceived threat. Anxiety is normal. If you're doing an exam or you're doing something for the first time, you're going to feel perhaps anxious, a little bit worried, and then you just calm down, you get through it. But for some persons, anxiety is severe. So more often than not, they're worrying, they're having just like, a tense reaction to a situation. They're having poor concentration. They're having difficulties just breathing and sleeping and just kind of making it through the day. So anxiety can be such a horrible thing for so many persons, just struggling through the day and not being able to accomplish goals. It's very difficult. So, I just want to touch on some of the things that you could actually do if you're experiencing anxiety. So first of all, what are some of the signs or the symptoms of anxiety? Some I just mentioned, but, you do have things like generalized anxiety. So you're finding yourself nervous. You're finding yourself feeling just worried. You're also feeling tense. You feel your heart racing. So it's like you're out of control with all of these symptoms. And in several settings, it's happening. It's happening at work. It's happening at home. It's happening when you're just kind of going for a stroll or a walk. It's happening just in just about every setting that you take yourself. And this could be a sign of what we call the generalized anxiety. It's a type of anxiety. And if this is you, if you feel you're experiencing all of this, it could be helpful for you to go to your mental health provider and explain what you're going through, because there's a lot more work that you could actually do to make it through if you're experiencing some of these symptoms. You also have what we consider to be phobias. Persons do experience all forms of phobias. And this is just a fear for something, a specific threat of danger. And it could be, it could be just about anything that you're experiencing that fear of. It could be a fear of heights. It could be a fear of, an animal. It could be, a fear of what we considered a social situation, that's social phobia. So it's just the fear of, embarrassment or just being in a social setting. And so for many persons who have that social phobia, when they enter social spaces, they become like, their heart is racing. They can't speak, they can't concentrate, they feel as if everyone perhaps in a room, everyone is hearing their heartbeat, which is never the case. But, that's what happens to persons when they experience that social phobia. All right. So, there's several fears that people do have, and several experiences of anxiety that people do have. But there's definitely help for persons who are experiencing these symptoms of anxiety. And I would love for you to go back on some of the previous videos that were done. I know I did one on mental health, recharge and reset. And I do have something where I'm showing how to do your deep breathing exercises. That's certainly just a helpful tip And I would encourage anyone who is experiencing some of the symptoms of anxiety, please go ahead, do some deep breathing exercises. And you don't have to wait until you're having that panicky moment, or you're feeling overwhelmed, or you're out of control with your thoughts and emotions. No, you don't have to wait for that to happen. You could simply do your deep breathing exercises, in the mornings, when you get a chance, when you're at work, or you're going out for a walk, or in the nights, as often as you possibly can. You want to do your self-care and relaxation, and that's going to really protect you from having those panicky or anxious moments where you're feeling out of control. And as I mentioned, the word panic, that's also another form of anxiety. So some things that you could actually do if you're experiencing anxiety. One, you have to make sure that you're going to be doing something like your deep breathing exercises. So you could go back and check the video that was done for mental health recharge, but you could actually start inhaling very slowly. You're going to inhale for 4 seconds, and then you're going to hold it for 4, and then you're going to exhale for 6 seconds. So it's very simple, and in that panicky moment, you could actually do a deep breathing exercise. It helps. One thing that you could actually do when you're experiencing anxiety, you want to make sure that you're actually doing some relaxation techniques. There can be forms of distractions from things that you're experiencing. It could be a very difficult work situation. It could be a family related issue that's going on that's affecting you. It could be a health concern. It could be just about anything. It could be a financial challenge. It could be just anything that can cause you to be very stressed or overwhelmed. So it's very important for you to just take time away from all of this and do some positive engagement in the form of distractions. And this could be those relaxation techniques. Go do your running, go do your jogging, go do your, your workouts in the gym. And thirdly, we want to make sure that we're sitting with our mental health provider if things get out of control. Sometimes we have excessive worry and we just cannot not do anything to help ourselves. So we have to go and sit in confidence with somebody you could relate to and who you could actually unpack some of those negative emotions and feel free. That helps so much. Or find a friend, somebody who you could confide in, and you start talking about some of the concerns that might be causing you to feel very overwhelmed and stressed. Those are just like tools that you could use, tips or techniques that you could actually start with. And there's a technique maybe you could ask your mental health provider about, using CBT, which is really gold standard for treating anxiety as well. So you want to be able to do things like challenging your thoughts a lot more. Challenge those thoughts, those negative thoughts. And something that you could do is evidence-based thinking. Is there any evidence to support the way I'm thinking right now? It's important for you to do that. And sometimes there's really no evidence to support, oh, I'm hated by everyone in the universe, so we want to just kind of refute things that we don't have any evidence to support. Sometimes it's just a thought, and sometimes it's just a fear. And once you're able to do that, you're going to find that it's going to decrease those anxious feelings or behaviors. But those are some tips and techniques that I'd love for you to pay some special attention to if you want to challenge yourself and help, work through the anxiety that you have been experiencing. So you want to do your deep breathing exercises. You want to make sure that you're doing your relaxation. You also want to make sure that you're going one-on-one with your mental health provider, or someone as well who you trust and you can actually confide in. You also want to make sure that you're doing something like evidence-based thinking. You want to challenge those thoughts that are not in fact truthful, and you want to make sure that you get some cognitive behavioral techniques. And you could ask your mental health care provider also to share some of those techniques with you. They're very helpful. they're very helpful in alleviating the symptoms of anxiety. All right, so I hope that I did say something that's helpful for you today. And guys, please go ahead, like, share, and subscribe. All right, so this is a wrap. See you again next time.